As you look at that slide, you can see that we've broken the state, as Jerry indicated, into 8 regions. These are regions we call the MERC regions. As we evaluated the regions, we looked at 2 things very carefully to define each of the regions. The first thing we looked at was travel patterns to work. We looked at this because, as we know, the disease can be carried from one place to another through movement of individuals. And there's extensive data that suggests how our workforce travels from home to work and back. And then lastly, this allows the state to be divided up into what's called labor sheds. The second key consideration we focused on in defining the regions was how health care is provided and reported on across the state. And as Jerry indicated, this is really important because the nature of hospital systems like my own and their capacity to deal with the COVID-19 outbreak varies significantly across regions and across the state. And so these 2 factors, labor sheds and healthcare considerations, healthcare capacity, were merged to define the 8 regions you see on the graphic. We'll use these 8 regions then to track the intensity and the evolution of the disease over time across our state, as well as the capacity of our hospital systems and our public health infrastructure to deal with it in each region. An example of that detail tracking is shown on the next slide, which track COVID-19 cases by MERC region over time, giving us a sense of trajectory of the disease and how it varies across geography. And as you look at that graphic, you can see that there are some significant differences in COVID incidents across our regions. This basic approach we will use to judge the readiness for additional economic activity in each region